greet you now. People where they travel, I want to tell una say una get right for treatment, service of health for Italy. My name na Elizabeth, and my work na to dey talk for people wey no dey understand language. I wan give una small information about HIV. I think una remember that word wey they call am AIDS. For Italy, people wey travel come this country wey know say dem get that problem for health. That virus, me I tell una say una get free treatment for Italy. Una fit go hospital, dem go treat una no go pay anything, even if una no get document. Remember say any woman wey get belle, wey dey inside this situation, this virus no be sickness again, na ordinary virus. E get treatment and e go still go help you. So we will give you number, we will give you address wey be say you fit get information to take talk to people. For now, una lis ten to this small message wey I wan give una.
The right to health is a fundamental right of all people, both Italian people and immigrants. This means that if you are a foreign citizen and live in Italy and you have a very serious health emergency or a severe disease or infection, you can go to the hospital and receive treatment you need, even if you do not have a residence permit. In Italy, doctors and other healthcare professionals cannot alert the police. Even though there is a degree of expulsion against you and you need urgent care, you cannot be sent back to your country until you are completely healed. If you worry you might be HIV positive, you can go to some of the HIV screening centers to get tested for HIV anonymously. And if the test is positive, you can access treatment and healthcare. If you do not speak Italian very well and you do not know how to explain yourself, you do not need to worry about it. There are in fact many hospitals and facilities where there are people like me who can help you to communicate. All healthcare professionals and mediators will guarantee the privacy of its patients. Urgent and essential care refers to all treatments without which there is risk to your life, and to all the treatments for diseases which, if untreated, can worsen over time and threaten your life and that of all others. Furthermore, if you are pregnant or are still a minor, you are entitled to all the treatments available at counseling centers and hospitals. The prevention and care of infectious diseases are considered as essential assistance. So if you know or find out that you are HIV positive, please, you are entitled to access care. HIV is not a disease but a virus, namely the human immunodeficiency virus. The virus can remain in your body for a long time without showing any signs of any kind. Over time, however, the virus weakens your immune system that protects you from diseases, and in this way you are more exposed to other infections and pathologies. We speak instead of AIDS, acquired immunodeficiency syndrome, when the HIV virus has compromised your immune system so deeply that other diseases take over. Today, there are effective targets against HIV treatments against HIV that allows you to have a normal life. For this reason, it is important to take the HIV test, which is the only way to know if a person is HIV positive. As we said above, the virus may not show signs for a long time, but even if you have no symptoms and you feel good, you can still pass it to other people. This is also why it is important to get tested. It is a matter of responsibility towards yourself and to others. But let us see how HIV is transmitted. The HIV virus is transmitted solely and exclusively through blood, semen, vaginal secretions. In addition, the virus can be transmitted from an HIV positive mother to her child through breastfeeding or during pregnancy and childbirth, if there are any injuries or any wounds. If a woman with HIV follows the therapies and certain precautions, cesarean section and bottle feeding, she can have healthy children. HIV can affect everyone. There are no special categories of people at risk, but only risky behaviors. So, actually, you do not have to be afraid of everything and anyone or to avoid people. You only have to pay attention to certain behaviors that can harm you and others. This is not a question of knowing people very well or trusting them, but because often they themselves do not know if they have HIV. Let us see what are the risky behaviors. The transmission of virus during sexual intercourse is the most common way many people think that HIV affects only people who have certain lifestyles, and therefore they do not protect themselves. All people who have an active sex life are potentially at risk. So in penetrative vaginal and anal intercourse, you always use a condom from start of penetration. The pill or other contraceptives will only protect from unwanted pregnancies, not from HIV and other sexually transmitted infections. Oral sex is risky for the person who stimulates with his or her mouth, the partner's genitals, while those receiving the stimulation are not at risk. So always use condoms and avoid receiving semen and menstrual blood in your mouth. Stop using condoms only when you are sure that you and your partner do not have other sexual partners and are surely HIV negative. You should take the together and after the so-called window period has passed. Since HIV is also transmitted through blood, you must be careful when using syringes, needles, razors, and other sharp objects. If you inject drugs, always use sterile disposable syringes and throw them after use. Do not pass it to someone else. The risk is very high. Do not share a toothbrush or razor with other people. If you get a tattoo or a piercing, make sure that the instruments are disposable and sterilized. Do the same when you go to the dentist. Remember, HIV is only present in the blood, semen, vaginal secretions, and breast milk. It is not present in saliva, sweat, tears, urine. HIV, therefore, is not transmitted through kissing, caressing, sneezing, coughing, or taking a bath together. It is not even transmitted through mosquito bites. No one has ever been infected with HIV by living with a HIV-positive person when you're using the precautions that have just been spoken about. As you see, we are all at risk, but it's also very easy not to risk. I know sometimes, especially if you're a woman, it is not easy to ask a man to use a condom, but it is important for your health. The reason why HIV is widespread in our country, in your country, and therefore also here in Italy, is that there are so many resistances about talking about sex and using condoms. We should teach our children safe behaviors. The only way to know if you are HIV positive is to do a specific test and receive a diagnosis from a doctor. Today, there are different tests. Most of the tests foresee a blood sample, but lately there are also rapid tests with saliva samples. People who are afraid of needles and syringes have a solution to their problems. If we do not use a condom during sexual intercourse with another person, we might be infected. Many people do not know that they have HIV and transmit the virus unknowingly. We too could be in this same situation, or we might have HIV but do not know it and risk infecting others. This is a good reason to take the test. But there is another important reason. If we know we have HIV, we can cure ourselves and live a normal life without putting any further risk on our health. In Italy, there are some centers where you can get tested anonymously and free of charge. This allows also foreigners who do not have proper documents to take the test safely. It is good to take the test when 3 months have passed since the last risky behavior. In fact, HIV test detects the presence of HIV antibodies in the blood or in the saliva, and the body takes a period of time ranging up to 3 months to build antibodies. If the test is positive, people are subject to a confirmatory test and subsequent exams. This helps them understanding when the infection occurred and if it is time to start taking antiretroviral therapies, that is, medications to keep under control the infection. In Italy, visits and drugs to treat the infections are currently free for everyone, even for undocumented foreigners like you that cannot be expelled because they are in medical care. It is important to keep in mind that taking a HIV test is the only way to know your own HIV status and have early access to health care. Remember, in Italy, there are so many screening centers where HIV tests are anonymous and free of charge. Consult the website www.lilamilano.it to know where you can take a test anonymously while receiving proper counseling and support. Today, over 30 years after the discovery of the HIV virus, having HIV is no longer to be considered a death sentence. If people with HIV or diagnosed today with AIDS assume HIV therapies, they have a life expectancy of almost equal to that of all other people. There are many people who are not aware of having the infection, but many years after this disease, because for many years this disease is asymptomatic. If you have HIV, the virus replicates silently in the body and attacks the immune system. After many years, when the immune system is severely compromised, the body is attacked by many infections that take advantage of this vulnerability. If instead a test is performed and is known that there is a HIV infection, we can cure ourselves with available treatments. These drugs stop the replication of the virus and prevent it from taking over and attacking the immune system. The drugs are prescribed by a doctor at the Department of Infectious Diseases hospitals. The doctor will perform regular visits to check our well-being. It is important to always take medications regularly without any breaks. If you pay attention to this, in a short time, in your blood, there will be no traces of the virus, and in this condition, it's extremely difficult to transmit the infection to others. Nowadays, there are still no treatments that allow a full recovery, but scientific research continues to progress, and in the future, probably HIV will finally be defeated. Being aware of having HIV gives the possibility to take the necessary precautions not to transmit this. Indeed, it becomes a responsibility. We must use condoms in sexual relations and avoid sharing sharp objects so that the people do not come in contact with our blood. For the rest, however, it is possible to live a normal life. People with HIV can work, have family and friends, get married, and even have healthy children. A woman who has HIV and takes therapies during pregnancy may give birth to a healthy baby through a cesarean delivery in the hospital, but will have to avoid breastfeeding. In Italy, there is a specific law that protects the privacy of HIV-positive people. It is their right not to disclose to others their condition. This law was issued to reduce discrimination against people living with HIV. Today, this situation has partly changed, but it is still difficult in some cases not to be subject to stigma. Contributing to the change depends on all of us. We must think of HIV as a disease that can affect all of us and treat people with HIV like all other people.
My people, when I see all this information, now for anybody who knows and get this virus, or if you get sister, you get friend, you get brother, you get mother, when you know say get this virus, fear no dey, shame no dey, because if you go meet them for hospital, everything wey you talk dey privately, nobody go ever know say you get am. If you want get more information, make una remember enter that website where they call LILA.